Yeah, welcome back. So let us look at an overview of dispensing principles that you must, have at the back of your mind during any of your preparations, calculations, labels, and the rest of them. So let us look at balances. So you use a balance in the examination. Most times it's usually a manual balance. So in the practical aspect, you're going to show how to use a manual balance and how to use the electronic scale balance. But most times what you're going to use in your exams is the class B manual balance. We're going to look at how it looks like, the class B manual balance. So this type of balance cannot measure less than 100 milligram. So anything you are doing in dispensing and you get masses or weights less than 100 milligram, you are expected to dilute. You're expected to dilute. That is aliquot method. You're expected to do the aliquot method before weighing it out. So we're going to look at it when we start doing capsules production. So let's look at conversion. You must be conversant with converting from gram to milligram and milligram to gram, because if you make any mistake there, you may get ambiguous weights to measure. So you must be very, very conversant in the conversions. That is why they taught you pharmaceutical calculations before coming to teach dispensing. So we're going to apply everything they taught you in pharmaceutical calculations in dispensing. So let us look at the measures. Now, to deliver liquid volumes, we are using measuring cylinder and pipettes to deliver liquids, because we use some excipients that are liquids. So we use measuring cylinders and pipettes. Now, orders and prescription. So remember, you're a pharmacist. So as a pharmacist, you always be coming across prescriptions. Now, some of these prescriptions are not really prescriptions that you just count out tablets and capsules and give. Some of these prescriptions are prescriptions that you must compound in the pharmacy, because dispensing is the science of compounding those small scale dosage forms for immediate dispensing to patients. So you must compound these dosage forms in the pharmacy. So this prescription is headed by the symbol RX. So let me tell you a brief story of how RX came about. Now, RX is simply a combination of R and then small letter J, not really an X. It's R and small letter J. Now, R means recipe, and then J means Jove or Jupiter. Now, recipe means take down. Recipe means recipe means like I'm receiving something. Yes. So recipe is the Latin word for receive. Then Jove is a god, the god of healing, the Greek god of healing. That is Jove. So if we combine both of them, we get the symbol, this symbol that we normally use in pharmacy practice. So this symbol is what heads the prescription. So all of our prescription is just telling the pharmacist, take this and dispense to the patient. Is a written instruction from any medical personnel about the drugs or whatever the patient needs, that you should dispense, compound, do anything to the medicine, and make sure it is in the safest dosage form that the patient should, have or take in. So it's now your duty as a pharmacist to read prescriptions. So we are going to read many prescriptions, and we take note of them as master formulas. To use them, you can go to your codex, get a formula for that, compound with excipients in the right dosage form, and give patients. So let us look at labels. Remember, I said before that labels bear what we tell the patient. So the doctor tells us something, we are the ones to tell the patient what to do with the medication. So this is a label. This label is for a cream prepared by a pharmacist. So the cream weighs 50 grams. So 50 grams was dispensed to the patient. So this is the heading of the label. Now, the cream is made up of an API hydrocortisone, which is for pain, for inflammation. That is what the cream is used for. So this hydrocortisone is the API. So you must also show the percentage or the components of the API in the cream. Now, this is the direction that you are giving the patient. So you told the patient that he or she should use as directed. So the direction may be anything. It might be applied for 2 times in a day. It might be applied with a brush. It might there are many directions you can give the patient. So as we go on and on, we are going to look at these directions. So you write your name, your reg number, your address, most times pharmaceuticals department, then the date you compounded the medication. So this is called auxiliary label. Very, very important. Auxiliary labels are subtle instructions that are different from the normal direction you give the patient. Like, how do you handle this preparation? What and what precautions do you need to have? You can say for external use, for nasal use, for ocular use, not to be taken, it to be taken at night and the rest of them. So these are auxiliary labels. So you must be very, very careful when doing your auxiliary labels. So I'm going to be giving you, as we go on, the correct and right auxiliary labels to be using for our labels. So let us look at 0 marks for a question. Now, please take note because I wrote them on red. Now, this 0 marks for a question means that if you just make this single mistake, the whole question would be cancelled and you score 0 in the whole question, regardless of whether you did well in other parts of the question. That is why I said these are 0 marks for a question. Like example number 1 can be a question on cream. So if you just fail maybe your calculation, you are scoring 0 in both your product, your label, and the rest of them, as sad as it may seem. So we are just doing this here so that you can be able to take notes of what this 0 attractor, so that you not have anything to complain of at the end of the exam. So wrong calculation attracts 0. Each step you miss or each wrong value you put in your calculation attracts 0 marks. So you must be very careful doing your calculation and calculate very, very appropriately as you're supposed to do. Now, wrong use of dispensing bottle attracts 0. So if you have any dispensing bottle that is not meant for the product you are dispensing, you score 0. Example, this is a cream. Imagine dispensing a cream. Instead of dispensing it in a collapsible tube, this is how collapsible tubes look like, where creams are put. You dispense them in, let's say, a bottle, a narrow mounted bottle. The patient cannot even access the cream. So that's wrong container or dispensing bottle. We attract 0 marks for that. Now, wrong instruction on the label, we attract 0. So any direction you did that is wrong attracts 0 mark. Now, wrong labeling also attracts 0. So any mistake in any of your labeling, maybe you didn't even write the active ingredients and when you're supposed to write, because there are cases when you should write active ingredients and there are cases where you shouldn't write active ingredients. We're going to look at them. So they attract 0 mark. No product attracts 0. So if you don't have a product at the end of the day, to attract 0 marks to the question. Maybe your product may not be really attractive. You still get your mark. Maybe they will deduct marks from a product, but not presenting any product at the end of your exam will attract 0 marks for the whole question. So these are the 0 marks for question chapter. So thank you so much and see you in the next video.